After President Trump nominated Seema Verma as the administrator for Medicare and Medicaid services, she knew moving from the private to public sector would be a challenge. Yet she wanted to help her country and even made the decision to commute each week between Indiana and D.C. to oversee multi-billion-dollar programs utilized by 130 million Americans.
Saw some of the things that were going on in healthcare and realized that our country was going in the wrong direction on healthcare.
One of the first things she wanted to tackle, patient confusion.
You don't have the information that you need in terms of how much are things going to cost. You don't know about the quality, and you don't have your medical records. I think there's a lot of confusion.
Verma wants to give patients the necessary information to make the best decisions about their health care through an initiative called the Blue Button 2.0, or My Healthy Data.
The federal government spent some $36 billion on investing in doctors and hospitals having electronic medical records, and I think that's exciting. But what happened in that is that all of the information is siloed. It sort of stayed in your doctor's office. So before it was a filing cabinet, and right now it's an electronic silo kind of right inside the computer.
Verma told CBN News how a personal emergency brought her face to face with this issue.
I get on the phone with the paramedics and they said, you know, your husband's not breathing. Is he on any medications? What's his healthcare background?
Information Verma didn't have.
It was a very difficult moment, just sort of there's so much going on, the panic of not being with my kids and wondering what was going on with him. For the medical professionals that were treating them, they didn't have the information that they needed to be able to diagnose him.
While her husband recovered, they still had to jump through hoops to get his information.
When I left the hospital, they gave me essentially a CD-ROM, and they said, here's his healthcare information.
In today's tech world, however, many computers won't even read CD-ROMs anymore.
I think the big issue was that a lot of the information wasn't even on what they gave me, and so there's all of this information about him that's sort of trapped at the hospital.
Verma says this lack of access is especially difficult for patients who move or see multiple healthcare providers.
We're working on an initiative to make it very clear to providers that that data and that information belongs to the patient. It is theirs. And we want to make sure that when they leave the providers, they have that information.
Under Verma, the Centers for Medicare and Medicaid Services, or CMS, is requiring providers to share this information with patients or face penalties.
You're going to have the ability to understand your health a lot better and what you need to do to improve your health. But you also have that opportunity to give that to your doctor, so your doctor's not repeating tests, there aren't safety issues, there's no drug interactions, so that's exciting.
Verma believes that will not only save time and money, but could lead researchers to find breakthroughs.
Because it's really going to give rise to the type of innovation that we've seen in the American healthcare system, but I think it's going to bring it to a much higher level.
What has the response been from some of the patients who are trying this?
Well, I think people are excited about it. You know, we hear stories all the time. I remember talking to some of our staff saying, you know, I'm going to a new doctor, and the doctor asked for all of my healthcare information, and she said, she's like, I don't have time for this, to go around to every doctor asking for information. And with this type of tool, she should be able to aggregate all of that information.
Verma tells CBN News they have more than 1,000 app developers working to make this data more user-friendly for patients.
It's things like an app that's organizing your medications. There are apps that allow you to take that information and put it into your doctor's electronic health record. And I think the exciting thing here is the possibilities are endless to see what American innovators are going to be able to do with this data.
And she believes this program will continue, no matter which party controls the White House.
Yeah, I think this is something that we have heard from both sides of the aisle about how important this is. And it's important on so many different dimensions.
Although healthcare negotiations are moving slow on Capitol Hill, Verma is trying to make the best of her current authority.
From my perspective, I'm going to focus on what I can control. That's one of life's lessons, to focus on the things that you can do. You know, we always stand ready to work with Congress if they want to make changes, and to provide them with the support as they consider changes. But in the meantime, I don't want to stand still, and I want to do everything that I can to make sure that healthcare is working for every American.
That means working toward the constant goal of lowering health care costs and making sure Medicare and Medicaid are sustainable.
And so we're trying to modernize the program, strengthen the program, do things in the program that empower our beneficiaries to have the information that they need, whether it's price transparency, quality transparency, or making sure that they have their medical record.
And what has your experience been like working in the Trump administration?
You know, for me, it's exciting to be here because we are with an administration and a president that isn't afraid of disrupting the status quo on behalf of the American people. And that's what I like about the administration, is that it's okay to be disruptive. The status quo isn't working for so many different Americans. And so the idea here is to be bold and make changes that are going to have a lasting impact to improve health care for our country.
Verma believes the changes happening at CMS can have an impact felt throughout the entire healthcare system. Reporting from Washington, Abigail Robertson, CBN News.